Hello and welcome in my channel. My name is Taha Sher. I'm a pharmacist, to be specific, bipolar pharmacist. Yes, I'm bipolar and I'm proud to be bipolar. Okay, today I gotta talk about Seroquel. Seroquel sells in USA, just in USA in 2021, $171 million. You can imagine it's a number. What a huge number. Okay, today inshallah we're gonna talk about its chemical characters, uses, mechanism of action, how to minimize side effects, drug-drug interaction, drug-disease interaction, and I will answer the most frequent asking questions. So let's go. Seroquel. Seroquel is from family called atypical antipsychotics, or this is the newest family with minimal side effects, so without extrapyramidal syndrome side effects. Okay, you get it? What about its active constituent? It has active constituent called quetiapine. It comes in almost 5 concentrations: 25 milligram, 50 milligram, 100 milligram, 200 and 300 and also 400 milligram. You get it, about 6 concentrations. What about forms? It comes in tablet, extended release tablet. It called XL or XR, extended release. It usually written by XL and XR. Both of them means extended release tablet. Okay, in some countries it comes in form of injection. You get it? It comes in form of injection, but I didn't see it in Egypt market or in Saudi market. I have worked in Saudi market for 9 years and in Egypt market 4 years. Okay, what about its bioavailability? Bioavailability for the brand usually higher than the generic from the same active ingredient. You get it? What about THAV for XL or XR for 24 hours. 24 hours. Metabolism, it usually metabolized by liver by enzyme called cytochrome P 3A4. Excretion, it excreted in kidney. What about FDA approval? It already approved 2006 for AstraZeneca company. It is an American international medical company. Okay, sales in 2021 from Seroquel normal form, Seroquel tablet normal form, $92 million just in USA in 1 year. Okay, and from the XL form, $79 million just in USA in 1 year also. Okay, you got it? Okay, what about alternatives? Here in Egypt there are about 15 alternatives. I mean here by alternatives, medications which have the same active ingredient, quetiapine. Okay, the most famous, Quetiapix, Quetcol and Quetiapine. Okay, I'm gonna write all others in description. In Saudi, there only one alternative which contains the same active ingredient called Adazio. Okay, and comes in 2 concentrations, 25 milligram and 100 milligram. Worldwide, there are a lot of alternatives worldwide, but the most famous, Temporolite. What about mechanism of action? Really, it acts by a lot of mechanism of action, but I abbreviate them here in 2 mechanism of action, 2 mainly mechanism of action. On dopamine, serotonin, and androgenic receptors, it acts as antagonist. Minimize levels of dopamine, serotonin, and adrenergic norepinephrine in the brain. Okay, you get it? Also, the second mechanism of action, potent antihistaminic. It is the most potent antihistaminic atypical antipsychotic. You get it? Especially on histaminic 1 receptor. This value called Ki for Seroquel 2.2 up to 11. Up to 11. It is the number 1 potent antagonist for H1 receptor. So it is used for enhanced sleeping, especially for persons who suffer from sleeping disorder. Okay. Main uses. It is used for bipolar 1 and bipolar 2. Bipolar 1 and bipolar 2. But you have to take care. In bipolar 2, it is a must to use with another antidepressant. Not alone at all. Because from its side effect is suicidal attack. We're gonna talk about it later, okay? Also used for schizophrenia. Also used for major depressive disorder, MDD, okay? What about side effects? Side effects on CNS, on weight, on endocrine. On CNS, it causes dizziness, sleeping, and suicidal attack. You have to take care from this point, okay? I'm gonna talk about it later in details. On weight, it minimizes the basal metabolic rate, it enhances hunger, it enhances blood glucose, and increases prolactin levels in the blood, okay? On endocrinology system, on liver, it increases ALT enzyme on liver, and also it makes problems in thyroid gland, okay? I'm gonna talk about how to minimize each side effect from Seroquel. What about drug-drug interaction? I have get tired. What about drug-drug interaction? Drug-drug interactions, the most famous drug-drug interactions with antifungal medications, antibacterial medications, especially clarithromycin and erythromycin, and with antiviral, okay? We have to take care from using Seroquel or any other medication which contain Quetiapine with these families, okay? The last part in this video, and the most important part, the most frequent asking questions, okay? Question number 1. Doctor, how to use it in major depressive disorder, and from its side effect, it causes suicidal attack? Really, it is an important question, okay? Major side effect usually accompanied by suicidal thoughts, suicidal attack. But Seroquel or Quetiapine used for major depressive disorder, which accompanied by suicidal attack with another antidepressant, 1 or 2 other antidepressant, okay? Not alone. How to minimize hunger and increase basal metabolic rate? Really, this is the question number 2. To be obvious, it is obvious to enhance basal metabolic rate by lifestyle change, diet, exercise, especially cardio on empty stomach. These activities enhance basal metabolic rate and decrease hunger. Also, we can use some supplements which not interact with Quetiapine or not minimize its action, okay? For example, Garcinia cambogia, CLA, or abbreviated, which is meaning conjugated linoleic acid, and some flavonoids, natural substance, okay? Not interact with Quetiapine and at the same time enhance enhance the basal metabolic rate, and at the same time decrease hunger. Okay, what about maintaining liver function? The best supplements at all, the best two supplements at all to enhance liver function, especially with persons who already taking any drink, any occasional drink or alcohol or others. Glutathione it is the number one antioxidant and enhances liver function. Amazing results. Number two is milk crystals. There are another supplements, for example, alpha lipoic acid and resveratrol, but the best two are glutathione and milk crystal. Okay, how to protect thyroid gland? To protect thyroid gland, the best supplement at all and not interact with quetiapine is selenium. You have to take selenium 200 microgram daily for at least 3 successive months yearly. Okay, I suffered question number 5, doctor, I suffered from gynecomastia. Really, gynecomastia, it comes from increasing amount of prolactin level in the blood, prolactinemia. Okay, to minimize gynecomastia or to solve this problem, from my point of view, not solving with any supplement. The best medications which contain bromocriptine or cabergoline, but it must be under supervision of 2 physicians. Number 1, your psychiatrist. Number 2, your endocrinologist. Okay. Question number 6, what's the difference between normal and extended release form from Seroquel? Okay, normal form highly absorbed, okay, and prolongation time of action in the blood is low. The XL form slowly absorbed, but it has prolonged time of action in the blood. Okay, you get it? Is it narcotic or is it appear in narcotic examination? Okay. Seroquel contain active ingredient called quetiapine. Quetiapine not narcotic medication, not narcotic drug, not appear in the narcotic examination. Okay, so don't worry. Is it safe for Alzheimer's? Really, it is not recommended in Alzheimer's disease. I have made a lot of studies about this, and I gonna put researches in the description, inshallah. Can I use it for Parkinson's disease accompanied with psychosis? Really, it is the best, the number one atypical antipsychotics for psychosis which come with Parkinson's disease. Okay, number 1, according to studies on 12 antipsychotics, Quetiapine, Seroquel, number 1, and with it, number 1 also clozapine with the brand name Liponix. Okay, I'm gonna put also the research in the description, inshallah. How to maintain blood glucose normal value? To maintain blood glucose normal value, the best and the most safest thing with quetiapine is diet, exercise, enhancing lifestyle, sleeping before 10, avoid any alcohol, any occasional drinks. Okay, something like this, the safest. Okay, there are another supplements and medications. Supplement the best to maintain blood glucose level is chromium. Okay, and medication the best at all to maintain blood glucose levels, it is metformin. I'm gonna make complete comprehensive video about chromium and metformin here in channel, inshallah. That's all for today. Don't forget to make subscribe on my channel. Bye bye.